Welcome to Health Law Talk, presented by Shahardy Sherman Williams. Health law broken down through expert discussion, real client issues, and real-life experiences. Breaking barriers to understanding complex healthcare issues is our job.
And good morning, good afternoon, whenever you're listening to this podcast. Welcome to another episode of Health Law Talk here at Shahardy Sherman Williams. Conrad Meyer, Rory Bellina at the pinnacle of healthcare law regulation discussion. Right, Rory?
That's right. It's a good way to describe it.
That's right.
Good morning, everyone.
Or yes, today it's 9 o'clock on a Thursday morning here in the greater New Orleans area. Actually, it's a pretty day.
Nice day. Nice weekend. Zurich is in town.
And you know what? Jazz Fest.
Coming up. Jazz Fest coming up. French Quarter Fest just ended. Zurich's going on right now.
We got a lot going on here.
It's a fun time to be here.
It is. And today, actually, we have a very interesting topic that sort of, parlays into fun.
Yeah, absolutely.
It's
too much fun, not enough fun.
Not enough fun or too much, depending on what you're looking at. Social media and healthcare, the risks, benefits, sort of the bear traps that you as a provider or a system or a facility might, want to consider when you're looking at social media and your policy, your procedures, and for your employees. And even if you're a solo doc or a group practice and you're not totally familiar with this is something you look at.
Yeah. I mean, this whole area has really exploded, and I think it continues to grow and grow and grow. And there's, it's almost a necessity that your practice is on social media at this point, because if you're not, all of your competitors are, depending on what industry you're in. But even with the big health systems, they're all over social media. So it's become a necessary evil that I think every health system, all the way down to solo practitioners, have to address. But there's a lot of factors, from the practice, from your employees, what you can and can't do. And there's so many different things that are coming out on social media that actually help you grow your practice. So, finding ways to properly integrate those and get the followers, get the likes, and then get people to come see you.
Yeah, I think, and if you're not, I agree with you 100%. If you're not connected, if you're not involved, you're losing business.
Absolutely.
And so when you look at the breakdown, even of who uses social media today, I mean, it's almost everybody. From whatever age range, income range, gender, race, location, geographic. Almost everyone is plugged in and connected social media wise.
And even the most basic things, it's really become kind of like the yellow book or the yellow pages or the white pages of a lot of practices. If you get referred somewhere or I need to go find a dermatologist, where should I go? You're going to probably ask a friend, and they're going to say, go here, and you're going to look them up, and you're going to see if they've got a Facebook page or an Instagram page, because you want to see what it looks like. Do they have, do they offer the injections I want? What are their hours? What does their staff look like? Does it look like not a dingy practice in a strip mall that, you're not going to want to go to? Does it look like a place that you'd want to go to? And so you're going to check those social media pages to see how that practice looks. And social media is just so much more easier to manage and update for practices compared to, we want to post a new picture of how we renovated the waiting room. We have to get it to our IT guy who's got to put it on our website, and it's got to get updated on their website. Now it's just post a picture on your practice's Instagram. Well, everyone's going to see it immediately.
True, very true. But I mean, that ease of use that you're referring to, that ease also comes with risks.
Absolutely.
And that's kind of what I want to talk about today is the risks.
And I see it in two parts. I see it as what you need to do as a practice or your practice manager on the social media, and then what you need to do for your employees. There's kind of two on managing your employees and their use of social media.
And that would also include the individual physician. So in other words, I mean, if I'm a system, or a facility that employs the physicians, then my marketing team needs to be keenly aware that I want to profile these doctors so that patients who are visiting the site, like you, to your point, know who they're seeing, know a little bit about them. And stay connected. So it starts at the facility level, a system level, even down to the group practice, and even the solos.
Sure.
So, and with that being said, so let's talk about risks.
Sure.
Okay, what in your mind? We could do rapid fire.
Sure.
What's some of the top risks you see?
I think there's two main branches of risks. I see that
Okay.
the one risk is from, are you posting something that's got PHI, or are you posting a patient that didn't give consent to be on the post?
So the HIPAA risk.
Yeah, exactly. With,
Okay.
Office of Civil Rights, are you going to get fined? Are you going to get a complaint? I think that's kind of risk one. And then risk two is just in the appropriateness of what you post. Are you posting medical advice that someone is going to read and they're going to rely on that, and could it harm them? Are you posting information that's not backed? Are you posting something that your insurance company, your malpractice might not cover based on the post that you made?
Right.
Is it appropriate? Is the board going to have an issue with what you post? Did you do a procedure incorrectly and now it's on your page's Instagram? And if there's a malpractice action, is the person that's suing you going to go dig through your Instagram and say, well, they did these injections like this on all these patients, and look, it's on here. It's very clearly. So, I think those are, the risks that come to mind for me.
So HIPAA, and then appropriateness of the post. I have a third.
Okay.
Okay. The rogue provider, nurse, staff, whoever, who post things about themselves or their work on their personal pages.
Yeah, and that's almost
And they don't even know.
That's almost I 100% agree with that, but I see that as like a whole other little category.
Well, that's why I said three. 'Cause
Yeah,
in my mind, because that's something that's different, right?
absolutely, it is, because if you're saying, here's Dr. Rory performing, liposuction or whatever it may be, and my name is tagged, and someone taps, my name, and then it goes to my personal page,
Right.
and then they're going to see all the stuff that I do in my personal life. Is that appropriate? Is that appropriate for the practice or the system that I'm working for? Are they going to want pictures of me, drinking or doing whatever on my personal page now, but everyone knows I'm now an employee of this health system? Are they going to be okay with, if I've got political things on there or religious things on there, are they okay with that? Because I'm an extension of that system or an extension of that practice. So, that's really important. It's like you almost have to, scrub your page or not have it linked, or have it where only people you approve can see those kind of things. It becomes a whole other issue.
And I tell that, I give that same speech to residents. I give it to young law students, MHA, like grad students, right? I tell them that the life that you lived in high school, right, or college even, the way you grew up, that's over.
Sure.
If you want to be a professional, you must act like a professional. Otherwise, you're going to get crucified. I mean, you're not going to make it, and that means your behavior, not only in the classroom or in the workspace, but outside the workspace.
Right.
And so, realize, just to your point, everyone's watching, and if you cross a line, and we can get to some examples. One recent example that I think you and I both know about.
Sure.
That we could talk about here. If again, I think that everyone has to be cognizant of that.
And I think it goes back to, this is something that my high school always impressed upon us is, no matter what you do, whether you're like on campus or off campus, you're still a student of this school, or you're still an employee of this system. So even if it's something that you did on a Friday night at the mall, and you weren't wearing any type of, high school uniform or whatever it may be, like, it's still a reflection on us, and we're still going to hold you responsible for that. Now, people that don't believe in that are going to say, well, no, that's not fair. Like, if I'm not on the clock, or if I'm not at the hospital, if I'm not at the clinic, and I do that on my own time, they should have no say-so over that. They're not paying me for my free time. What are your thoughts on that?
I think that doesn't matter, and that argument wouldn't hold water, because
I don't think it holds water anymore.
Anymore.
Sure,
right?
I think it did probably when social media started. People didn't know how
not
to
now
handle
though,
it,
because it's 24/7.
Sure.
And so you can't argue that, hey, when I'm off the clock, hey, that's my time. No, because really your personal time is also, you're an extension of that company, an extension of that group. You're a reflection, like for us, we're a reflection of the firm we're in.
Sure.
And so you can't just go willy-nilly and post something, say something, do something for the world to see. Now, let me just say this. If you had your Facebook group or your, I don't really do Instagram. I'm sure people will tell me I'm antiquated, but I have one, but I'll look at it. I don't post anything. But if you have it set to private, it's only your friends. That's kind of one thing. But even then, if you have a lot of friends who disagree, with maybe something you might post, right? Whether it's a political view, a position, whatever, you're putting yourself at risk even within your own collective private group.
Yeah.
I think.
Absolutely. No, you're putting yourself at risk, and depending on what you post, a lot of employers they don't want you to post political, religious, controversial things.
That's true. My dad told me it's always good just to talk about sports.
Yeah. Yeah.
Like the Saints here in New Orleans, right? Or LSU football, Tulane football, any kind of sports, because you can disagree about sports and nobody would really care. You like LSU? I don't like LSU.
Sure.
You like the Saints? I don't like the Saints.
Sure.
You can't go wrong with that.
I think practices have done a really good job. At least the practices that come to mind with most practices that I know have good policies and procedures in place, and one who can actually post on the account, for the practice.
Right.
Managing that, not giving the password or the keys to everyone to actually make the post. And then if a post is going to be made and it's going to involve a patient, make sure you've got the patient's written consent. If you're showing a video of an injection, that the patient's okay with that. That you're not showing any revealing body parts because you don't want to get into the pornography aspect.
No. I mean, look, let me tell you, most facilities I know, groups, and I agree
do
with
really
you,
good jobs.
They do a good job. They have the policies and procedures. What I find more now is the rogue people who now, like for TikTok, for example, TikTok, it's so easy.
Sure.
Everyone loves TikTok. So you got employees, right, or individuals who are posting things on TikTok that really aren't kosher, and the group can't control, or the facility can't, the system, they can't control that.
Or occasionally it's an inadvertent exposure.
Well, because they don't understand. Like they just say, "Oh, I think it's cool, it's funny, and ha ha ha."
I've had one instance where a practice posted a picture, and they were going around like interviewing different people and saying, why they liked XYZ practice. And as they were going around doing the interviews,
all the patients were around.
It wasn't the patients that were around.
What's
it
that?
was that it was a very close up shot, and you could see this employee's computer screen. And then she was working in a medical record, and so so it's something that you're not even thinking of. But if someone really wanted to, they could freeze that frame, zoom in, and say, "Oh, look, she's working on Roy Bellina's."
Right.
Those are the little inadvertent things that unfortunately we have to deal with. And is that a breach? Arguably, yes.
You're being nice. I'm thinking of the more egregious stuff.
Sure.
I mean, I had a case involving it made the news actually, where I had to represent some nurses. This was a long time ago, but someone came in to an ED and they were, I think, either was it intoxicated or they had some kind of a drug problem. Anyway, they charcoaled an individual, and then they decided to paint the charcoal with mustache on the patient's while the patient was out, and they posted the pictures on social media. And it was terrible.
Yeah.
I mean, it made the news. There was a lawsuit about it. Blah blah blah. And I'm thinking that's the egregious stuff I'm talking about. And most recently, and I'm not going to go into the name, right? But I will tell you, you and I both saw it, the TikTok video of employed staff at a facility, a large system, right? In the background of this, terrible choice of music.
Sure.
Wearing their uniforms, doing things on a TikTok at the actual facility location, and they thought it was, and obviously it was clearly choreographed, clearly thought out, clearly, they just didn't do this on a whim. Like, you kind of scratch your head, Rory, and you think, what are you thinking?
Sure. And there's so many, if that landed across my
desk. You know what I'm talking about, right?
Yeah, absolutely. And when I saw the video and was thinking about it, how would I react to this?
Kind of like disbelief.
Yeah, there's so many aspects of that. It's one, you shouldn't be recording unless you've got it approved by your system or your practice. Like, you shouldn't be recording anything on social media at the workplace, because if you're not careful enough, you're gonna have patient files in the background, or you're gonna have something in the background that you just don't think about, right?
Yeah.
So unless you get it approved, don't make a post or don't do anything that's going to be on social media, because once it's on there, even if you delete it instantly, someone did a screen record of it. It's out there, and you're not going to be able to get rid of it.
Well, it was taken down, and you and I both.
But there's still screen recordings of it, so
all over the place.
Correct. So you're never going to be able to get rid of it. So it's really important to impress upon, if we're shifting now to what should policies and procedures be in place for employers, is
And I have some draft ideas for that. We can share that here.
Yeah,
and
absolutely.
I agree with that, right? I didn't mean to cut.
You're
I
fine.
totally just cut you off.
No, it's fine.
So, what about that? Remember the med student, or was it a resident? I mean, national news that she was in an Uber. It was a woman, and she was in an Uber driver, and she obviously had a little too much to drink.
Sure.
And she started just laying into the Uber driver. It made national
I do remember
news.
that. Yeah, I do remember that.
And somebody recorded or was it the Uber driver or someone recorded her tirade and posted on social media. And I think she lost her residency for that. Like,
Yeah.
I think she was removed.
Yeah.
You know, so I mean, and that's what I tell people. There's serious ramifications for those rogues who think that you can just go on social media and do anything.
Yeah. Yeah. It's a really slippery, dangerous slope.
What about fraud? What about anti-kickback, or like, you know, if you're doing, for example, let me just throw this at you. You're doing a social media post on a device.
Okay.
Oh, we just got this latest device.
Okay.
For our practice. It's going to help, you know, improve whatever the device is meant to improve.
Right.
All right. Is that problematic? What if you don't have that? I mean, without the permission of the device manufacturer, are you now somehow,
Yeah, I mean,
exposing yourself when you do stuff like that?
I think the kind of the issue with those little snippets or those little posts is that people love and want to see that. But is that taking in the context of, are you giving medical advice? You're not able to give the full background if you were doing a white paper or like a full, FDA disclosure on the effectiveness of the drug or the device. So yeah, you're saying, this laser is gonna decrease varicose veins by 50%. Well, okay, but I'm sure that the company that made that laser has a 50-page paper with all their studies that talks about, in certain studies it did reduce that, but here's all the other caveats to it.
Sure.
But you're not going to be able to mention that in a 10-second Instagram video. But now that video is out there, and if you get a patient where it doesn't decrease their varicose veins 50%, and are they going to sue you for malpractice? And is that going to be Exhibit A, saying you said it would reduce by 50% in this video? You lied to me, or you gave improper medical advice. That's the part that you just got to really be careful with what you say, because it's going to live out there forever. And I think that's what I try to impress upon people is, just be very careful with the advice you give or how you promote something online.
What about the the ASC, for example, right, or a facility, for example, that touts the latest robot? Because people like technology.
Sure.
People, when you walk into a doctor's clinic or you go to a ASC, ambulatory surgery center, or a facility, you want to know that whatever procedure you're getting done, that you're getting it worked on. You're being worked on by the latest and greatest, most technology. And so, what about the ASC that says, "Oh, we've got robotic surgery," right? And they advertise that, on social media, on any place, Do you see risks associated when you take that route, or is that more of a safe play? What do you think?
Yeah, a lot of those advertisements that I see like that, it kind of reminds me of the pharmaceutical and the drug commercials. So if you see a drug commercial for, Ozempic is the one that comes to mind. It's a type 2 diabetes drug, but it's obviously being used off-label right now before it reaches FDA approval for weight loss. So the commercials say in the snippets, and it's it's got a husband and a wife riding a Ferris wheel, or grandfather fishing with his kid. It's got these scenes of happy people taking these drugs, and it says here's what it does. But then you've got that little fine print that says
that you can't read,
and says,
or the guy that talks so fast.
Right. Side effects may include nausea, depression, anxiety,
Right.
death, and then please go to our website for more information. So those are all the caveats, right? And they're putting that there to cover themselves because they're required to by law and because they've been sued before. But those aren't in the social media posts. So, you're losing that little barrier of protection by not having that in there. So that, I think it's fine to, you obviously want to get out there and promote your devices as much as possible, but you've got to have some sort of disclaimer or something to say, this is not the same thing as medical advice, and you really need to talk to someone. Don't rely on this.
So I'm not going to go over the minutia details of a social media policy, but I'll hit some of the highlights.
Sure.
I think when you're drafting these policies, even though you can't control the rogue individual who does their own TikTok or their own Facebook, some of the top line items, I think, in policies. First off, decide are you going to encourage the staff or discourage the staff from engaging in that facility's social media accounts? Okay, who are you going to say, hey, everybody come in and y'all post your own thing? Or are you going to say, we don't want you touching it. We have our marketing team. We're going to do it. Don't touch it.
Is it going to be one person? Do we want interactions? Do we want commentary with people that comment on the post? That's a great point.
Time and place. Okay. In other words, so now if you are encouraging, are you doing it work hours, not work hours? You know, when people leave, they want to check out. So you know, is there some time and place that you're encouraging this if you are doing that? And to your point, third thing, authorized versus unauthorized. Who can do it? Who can't? Right.
Right.
Disclaimers, very important. You mentioned that.
Yep.
You know, what would you put in a disclaimer? How would you treetop level? I'm not asking.
Yeah, I think most practices that have their social media pages, they're going to have in there the typical language that says this is not medical advice. Please contact your healthcare professional. So anything in there that they're advertising or marketing on their social media, it's going to have in there that this isn't medical advice.
Well, and then I think you have to really kind of discuss in the policy what kind of content are we talking about here.
Sure.
And so everyone knows, especially when you hire on a new employee, I think you need to have that policy where they sign off on it.
Sure.
A lot of people will come back, I didn't know. No one told me.
Right.
You can't deal with that.
And I think that for big systems, you can't screen everyone's social media before you hire them. But what you have to have in place is the ability of, if they become aware that there's something on your social media that doesn't align with that system's views, that they have the ability to terminate you. I mean, in Louisiana, it doesn't matter because, you know, we are at will employment here. But I think it's important to have in there that, you know, if you agree with this, that your social media is an extension of you, you're an extension of this practice. And if you have something on there that doesn't align with this practice, we're going to terminate you.
What about when providers communicate with patients via social media? That's something that needs to be decided.
Yeah, I mean, and that's a whole other area that's getting into. There's AI and there's bots for scheduling patients and doing like that initial questionnaire.
Right.
That's a whole other thing. I think that it's great, the technology that's out there that's doing these intakes and that's kind of screening these patients.
Sure.
But is that considered? Is that considered at that point giving medical advice? I know one in particular had a consult on this, and it was for someone that wanted to start an online, like a men's health type clinic, but they wanted to do an online section.
Oh, you know what? I remember you and I talked about that.
And and we looked at it, and
it looked great.
And what they do is they do about 10 screening questions. Name, age, height, do you have a history of
weight,
all
these
type of things? What concerns do you have? What are you looking to address? Basically, what do you want to get out of this?
Yes.
A lot of it was ED drugs. And at the end, after all that, they're like, okay, now we're going to schedule your visit with the healthcare provider through telemedicine. And I presume that provider's going to get a sheet and they go off of it. So that's all screened, but that was all done. They were using a program to collect all that, a bot to collect all of that data.
Right.
Which I think is, okay to do as long as you've got the doctor at the end that's really going to review it and not just rubber stamp it.
Agreed.
But that's a really good way to use social media to kind of streamline your practices, because it's so easy for someone to answer some questions on their phone. If they see a Facebook ad for something that's interesting to them, answer these questions, and then talk with their doctor about it.
Well, I think one thing, too, when you talk about bots and things, the automated process that you were just alluding to a moment ago, one thing that I think providers, facilities need to be cognizant of, does that information get put into a medical record per HIPAA? Right, where does that information live? And where does, so if you interact online on social media, right, okay, because remember, you have your EMR within the clinic or within the system or within the facility or whatever, but where does that PHI potentially, right, live in social media, and how does it get into a protected record set per HIPAA? Or does it? Like you said, maybe that the information that was collected in respect to this Men's Health thing just sat in cyberspace somewhere, right? And it never really even made it to the record.
Sure. Yeah.
So I mean, I don't know. It's so many moving parts.
These are all these new integrations with social media
Yes.
because this was an integration on their Instagram page where they had their ad and they, tap here to get more information and it goes right into the bot.
True, and you know what? And I think this is something we do another episode
Yeah.
on. But how does like a program like the ChatGPT, how would that interface with healthcare?
Sure.
And or the technology behind ChatGPT, right? Integrate with healthcare. I mean, so a lot of really cool, interesting things that we should talk about. I know we hit a high level discussion.
The most important thing I think is having something in place before you have an issue arise. And most of these
when you integrate it, mean with an employee
when you're
onboarding?
opening up a practice,
Yeah.
if you're opening up a solo practice, if you're opening up a small med spa, if you're opening big systems, like you've got to have procedures in place to understand because you have to have social media. So it's just you're going to have it, but how are you going to control it? How are you going to regulate it? Really talk with your employees and talk with them about if we're going to be posting pictures, how do we make sure?
I think that has to be ongoing, though, don't you?
Absolutely, yeah. It's always changing, and you always have to be really
because they'll forget. They're just because it's out of sight, out of mind.
Yep, they'll forget or they'll just let something slip, and
Oops.
a patient's going to catch it, and a patient's going to report you to OCR, and then you're going to have to deal with that. So,
or they post something like what we saw recently on
Sure.
TikTok to the world, and now all of a sudden, hey,
and that system had to send out an email to all their employees reminding them
Yep.
what their policy was.
correct.
So.
All right. Well, look, I think that's going to wrap it up for a quick little episode here on social media and healthcare. Rory, I think this is something we have got to come back to, So anyway, enjoy the week, everyone. We will circle back on this topic soon. Enjoy it. And thank you very much for listening to another episode of Health Law Talk. Y'all have a great day. See ya.
Thanks for listening to this episode of Health Law Talk, presented by Shahardi Sherman Williams. Please be sure to subscribe to our channel, make sure to give us that 5-star rating, and share with your friends. Shahardi Sherman Williams is providing this podcast as a public service. This podcast is for educational purposes only. This podcast does not constitute legal advice, nor does this podcast establish an attorney-client relationship. Reference to any specific product or entity does not count as an endorsement or recommendation by Shahardi Sherman Williams. The views expressed by guests on the show are their own, and their appearance does not imply an endorsement of them or their entity that they represent. Remember, please consult an attorney for your specific legal issues.